Hey guys, Dr. Brian Opp here from Opp Family Chiropractic right here in St. Francis with Mike, our rehab specialist. And this month we're talking all things men's health. And one of the most common things that men come in with into our office is low back pain, right? So guys trying to do too much, getting out of shape, whatever it is, whatever causes it, a history of injuries to the area, whatever it is. It's definitely very common. It can be very debilitating. So we take it very seriously and try to get those guys back up on their feet and feeling good so they can be productive members of their family, their community, and just the world in general. So Mike's going to take us through a few things about low back pain this month. All right, Mike, go ahead.
Absolutely. So like Dr. Brian said, low back pain is one of the most common diagnoses, if you will, worldwide. And the first thing I'd like to say is that there is a cause of your low back pain. Obviously, if you were lifting something heavy at work and you threw your back out, something like this, but many people will go to a PT or to a back specialist, and they'll say that it's non-specific. There isn't a cause, right? And this is incorrect. There is a cause. There's something making your back hurt, right? And so that's number one. There definitely is a cause, right? And the second part is structural changes in your back as you age are normal. So you'll hear things, stenosis, so a narrowing of your spinal canal, degenerative disc disease, things like this, right? These things are all pretty normal and are not necessarily the cause of your pain. They might be, or they might be contributing to it, but it's not necessarily the cause. There are definitely people with herniated discs that don't feel any pain at all.
Correct.
And this is a common thing. So what can be done about it? For a lot of people, the soft tissue work, exercise, and movement education can definitely move the needle a lot on people's low back pain. One of the biggest things I see is a lot of people having trouble bracing their core and then moving about their hips. So they bend at their back as opposed to at their hips. And so for a lot of people, learning how to do these two simple things helps with their back pain, helps you to not pick the scab, so to speak, with whatever is aggravating your back. Another common thing that I know you see a lot of is stress. Stress will shut your core off.
For sure.
And that will definitely contribute to your low back pain. If your core can't function, that is what holds your back in place. And so if it's not able to do that, it will almost certainly hurt. So supplements will assist with that. And then obviously all this in conjunction with the chiropractic adjustments, making sure your vertebrae are aligned, right? All of that can definitely help move the needle as far as your low back pain is concerned.
One of the things that Mike really does well here in the office is we've started to do a lot of RPR, so reflex performance reset, which looks at different patternings. How are you firing? How are you not firing certain muscles? So, often the side that hurts is the side that's been doing all the work. So figuring out which muscles are not pulling their weight to get them to do that extra work that they need to do to be able to balance that body out is usually what's going to create a lot of this low back pain issue. I love that he talked about stress, right? Stress is a huge component. 75 to 90% of all the visits that come into the office here, there's some stress component. And stress comes in many different forms. That's the foods you eat, the movement you might not be getting. Everybody knows the psychological, social stresses that we come into contact with. And then just the things that, in our environment, right? The chemicals that come into our body, those are often all types of stresses that we have. And we handle all those types of things. We like to have a well-rounded clinic so that you're hitting mind, body, and your soul, right? Essentially there. So getting all those things fixed and worked on is definitely beneficial for your low back pain. And like you said, there is a cause. Figuring out what it is our primary goal, and helping you to overcome a lot of those things is what we do here best. So Dr. Brian Opp here from Opp Family Chiropractic with Mike, our rehab specialist here, helping you be healthier this month. Thanks, guys.